Hi, my name is Dr. Olumuyiwa Idowu. I'll be working out of the East Valley offices, Simi Valley and Thousand Oaks. So I grew up in Staten Island, New York, primarily. I was born in Trinidad and Tobago. My parents lived there for a few years, but kind of grew up on the East Coast. So I did my schooling a little bit all over. I went to undergrad at Washington University in St. Louis, studied biochemistry there. It's a great place to actually go for undergrad, very different from New York City, but I learned a lot. Then I did my medical school training at University of Chicago before coming here to Southern California for my residency training at LA County USC, which I enjoyed a lot. And finally did my fellowship at NYU in spine surgery. I had a lot of medical influences in my family. My father's a psychiatrist. My mom was an OR nurse for a long time before becoming a nurse practitioner. So I think that sparked my initial interest. I think the thing that kind of got me interested was kind of the combination of lifelong learning and then having, a direct impact on someone's life. I think that part of medicine is very unique. Orthopedics kind of got my interest because of the part, that's a blend of anatomy, but also being able to help patients with function. I think that part is very special, and seeing that, physically in front of you, I think is something that you don't always get in other aspects of medicine. I've been trained in general orthopedics, but my specialty is orthopedic spine surgery, and so that involves treating all conditions, related to the spine, from occiput to pelvis specifically. But that involves treating a condition such as spinal stenosis, disc herniations, nerve compression, some spinal deformity, as well as myelopathy. And so all those treatments, can involve different parts of the spine, but affect, all aspects of the body as well. I think the care of patients should be very much tailored to the patient. I think the way to deliver the best care is really to listen to what the patient's needs and goals are. Just because you see something on an MRI or X-ray doesn't necessarily mean that that's what always needs to be treated for a patient if their goal of care is different from another patient. And I think, especially in spine surgery, that rings true a lot. Kind of figuring out if the patient is primarily focused on their back pain or their leg pain or nerve pain that they're feeling is really going to tailor what you do for them, and whether that means operative or non-operative. And I think discussing that with the patient, having a very informed discussion, is always important to getting the best outcome. I love live sporting events. I like to travel a lot. Me and my wife especially like to try new restaurants when we go abroad. And then just staying active in any way I can, whether that's hiking, playing basketball, less active sports like golf and tennis. I've kind of been trying to get into as well. I think the thing that impressed me about Ventura Orthopedics was really their community engagement. I think in orthopedics there's a special opportunity to be involved in the community in a lot of ways, whether that's athletic events, but also events that involve some of the geriatric population as well. And I think there's a niche there that you can really be involved in patients' care from the time they're young to the time they're old. And I think Ventura Orthopedics really embodies that mantra of treating the whole patient. And I think that was something that kind of gave me the confidence that I was going to be able to practice patient-centered care when I came to be a part of this group.